Well, there was a slew of immigration-based laws passed this last session, and now another one has been partially blocked. A federal judge put this temporary and partial pause in place a day before it was set to take effect, which was today. House Bill 135 requires individuals to prove they're in the U.S. legally before receiving certain public benefits, including a federal program that provides free HIV medication to low-income patients. Brenda Rodriguez joins us now. And Brenda, this block only applies to one section of the law. The rest of it does go into effect today, correct?
Right, that's right. And the one that is blocked pertains to HIV, as you mentioned there. And ACLU says that the temporary restraining order protects undocumented people from a ban on access to life-saving HIV medication through the Ryan White program. An Idaho doctor and 4 undocumented patients sued the state, claiming that the new law will cut off life-saving HIV medications from immigrants who are entitled to them under federal programs. And they say that this would create an uptick in the spread of HIV in Idaho. But again, this is just one piece of that law. The rest will still go into effect. Right now, eliminating non-emergency health care and certain social services for undocumented immigrants. Bill sponsors say that that includes things like soup kitchens.
Crisis counseling and intervention, short-term shelter specified by federal law. We've struck that, but then we've added back in at short-term shelters, and there's definition below. For prenatal care, postnatal care, not to exceed 12 months, and for food assistance for dependent children.
The ACLU says that the language of this law is confusing and dangerous. While this is now in motion, they are hoping to stop the rest of the bill from staying a law.
It has potentially very wide ramifications for a variety of areas, and all of them are harmful, and none of them solve any problems that the state of Idaho has. And so it was really important to us to fight for the immigrant community because they're just as important as anybody else, and they deserve access to life-saving measures.
And the ACLU of Idaho says that this restraining order, again, just pertains to HIV medication, and this ban will be in place for 2 weeks to consider, or while the court rather considers the plaintiff's motion for a preliminary injunction there.
Which, yeah, these TROs only last for like 2 weeks, and then they have to have that hearing to see if it's going to be extended. And well, the other thing the judge did was grant class action to this, so it doesn't just apply to the 5 plaintiffs that are named in this case. So it kind of broadens it a little bit, at least this injunction.
Everyone who, I guess, falls under this umbrella, yes.
It was interesting, during debate during that bill in the State House, several Republicans voted no because of how it would impact children in this case with soup kitchens and medical care. Yeah,
and we also heard the Idaho Food Bank testify in this as well, saying this is harming children, American children, as we've talked before. So yeah, this isn't something that they wanted as well. So organizations would have to turn away essentially people from these services.
Yeah, all right, we'll see what happens on July 15th when they have that hearing. Thank you very much, Brenda.